Imagine being startled by the slightest noise and having a life expectancy ranging from 2 to 6 years. That is Tay-Sachs disease, or the symptoms of Tay-Sachs disease. Here you can see an infant with Tay-Sachs and the places that are commonly affected by Tay-Sachs. Now, first of all, what is Tay-Sachs disease? This is also commonly known as GM2 gangliosidosis or hexosaminidase A deficiency. So this can cause neurological problems, which means death of nerve cells, and this is a defect on chromosome 15. Normal people have 2 copies, but the carrier usually only has 1 copy of this on chromosome 15, which is easily passed on. Now, there's something called hexosaminidase A, which is found in lysosomes, which is this is also an enzyme, which basically what happens is, since there's a deficiency of this hex A, the GM2 gangliosides, which are found in cell membranes, and they're also lipids or a fatty substance, they grow in the nerve cells abnormally without this enzyme. And usually this starts in early pregnancy, but usually starts showing up through symptoms at 3 to 6 months of age. Both parents must be carriers, and there would be a 25% chance of inheriting this disease, 50% chance of just being a carrier, and 25% of not having this gene at all. Okay. This is most commonly shown in Eastern European Jews, or Ashkenazi. About 1 in 27 of them usually get it. And in the US, the incidence rate is 1 in 250 or 300 people. And right here, you can see healthy neurons. And over here, the neurons become swollen because of the abnormal growth of the GM2 gangliosides. Here is a healthy retina. And here is something in Tay-Sachs, which is called a cherry red spot, which I'll be getting to in the next slide. So the symptoms. First of all, Tay-Sachs is an autosomal recessive pattern, and this causes slowed muscle development, a startled reaction to loud noises, myoclonic jerks, which are muscle twitches, loss of acquired skills, daily life skills that we would need. It causes seizures at very young ages, dysphagia, which is difficulty swallowing, and then vision or hearing loss. It also causes mental disability or intellectual disability, and a cherry red spot on the eye, which I was talking about before. And this is all infantile Tay-Sachs, which is the most common type of Tay-Sachs, by the way. Research is actually showing an increase of this disease not only in the Ashkenazi but also the French Canadian communities in Quebec, and the Old Order Amish community. Death usually ranges from 2 to 3 years of age, but some sources are actually saying 4 to 6 years. And here's just showing how autosomal recessive traits look. So if both parents are carriers, right here, the purple thing, that means there's a chance for it to be passed on to a child, which is 25%. 50% of them would have a chance to be carriers, and 25% of not having the gene at all. And here you can see the lack of muscle development and acquired skills, and here's the brain of a person with Tay-Sachs. Also, the OMIN number is pound 272-800, and this hashtag in front of the number represents a homozygous or compound heterozygous mutation, which is in Tay-Sachs, and this is autosomal. This is an autosomal recessive disorder, which means it's located on a chromosome. And right here you can see, since it's in the 200,000s, you can see autosomal recessive loci or phenotypes. So this is the one. Inheritance and cloning. So first of all, both parents must be carriers of this autosomal recessive gene, and this is a variant of the hexa gene. And the carriers, they might not show any symptoms at all, so it's kind of hard to figure out if they're a carrier. So you would have to look at the whole family, like genetics, and look at these different type of mutations. And the chance of inheriting it if both parents are carriers is 25%, as I talked about before, and this has an equal chance in both males or females. And there has been a cloning project done, having the hexa or the enzyme cloned at the NIH, National Institutes of Health, but it was not patented or licensed, so it's considered a public domain, or publicly domained. Publicly domain, yes. Okay, and here you can see the enzyme right here, and the GM2 gangliosidase, and the enzyme, since it's not present, this means this would abnormally grow in the cells. And here, since GM2 gangliosidase is an enzyme, a lipid, fatty substance, you can see all the fat in the brain cell. And there has been genetic testing done, and it's through screening and prenatal diagnosis, usually around the 10th or 12th week of pregnancy. The woman would have to get CVS done, which is called chronic villus sampling, where they take a sample of the placenta and check for any abnormalities. And then around the 15th to 18th week, if they see a progression or see that they have Tay-Sachs, they can do an amniocentesis where they take a sample of the amniotic fluid and test for that, or any blood tests as well. For treatment, there's no cure known yet, but there are medications to relieve pain and manage seizures. However, there was an assisted reproductive therapy done on a woman called in vitro fertilization, and it was implanted into the mother, and I think they noticed some differences in the Tay-Sachs, which is an ongoing gene therapy, and there have been 2 successful tests of this done at UMass Chan Medical School, where there were less symptoms shown in the kids with Tay-Sachs, and they were living higher ranges. And there was actually a case study done on a Greek Cypriot boy, which is in Turkey, as you can see right here. He was 5 years old, and the parents started noticing symptoms at 4 years of age, such as night terrors and loss of motor skills. He had an electroencephalogram done and an MRI, and they saw some differences of Tay-Sachs, and he started developing intellectual disabilities, and his sleep was always interrupted, and his family actually hospitalized him, non-extensive, meaning he doesn't stay there all the time, but he stays on sodium valproate and risperidone and attends a special needs school, so that's how they're taking care of him. Here's my works cited.